Now they have been looped out and excised and degraded, so this has been damaged. Now VDG combination has directly come in contact with the gamma 1, so there will be release of the immunoglobulin G1 and this will be formed. So if it is loop out and form this alpha 1 over here, and all this portion is loop out and degraded, then there will be formulation of immunoglobulin A. If all will be the loop out and then only directly comes to the immunoglobulin, that epsilon, then there will be the formation of immunoglobulin E. So this is the class switching, and that occurs due to this by the signal, the cytokine integrated structural signal that has been sent from the helper T cell. So you understood how this has been formed. This has been formed. It is does by rearrangement the DNA encoding the constant region of the heavy chain by activating the switch region that causes the intervening DNA, the between DNA. So this is the DNA sequence, and the intervening DNA, what will happen is looped out. So you can see this is looped out and this is looped out, okay, and then looped out, excised and degraded. So what will happen, this component will be looped out. So this you can see over here, this portion is looped out, here is this looped out, and they will be excised and degraded and directly form the PTJ with gamma 1 that will lead to the immunoglobulin G1. So this is the immunoglobulin G will formed. Okay, if it is looped out from here, this all will, then immunoglobulin, this will come direct over here and there will be the immunoglobulin A will form. If it is direct linked to the, this all will be looped out and excited, then immunoglobulin E will come over here and that will form to immunoglobulin E. So in this way isotype switching occurs. So hope you have understood this isotype switching as well. Looped out, the isotype is then join a new constant domain resulting in antibody molecule with identical antigen specific but with a new effector function. This isotype switching is one way. The excised DNA is degraded, so a cell has begun to produce an isotype downstream from the IgM coding can never produce the IgM again. So then since there is the looped out, the mu has been not there, now they will form the another immunoglobulin. This is why immunoglobulin M is the principal immunoglobulin of primary immune response when antigen is first encountered, and then it is replaced in later response by the antibody of different isotype like immunoglobulin G. Although IgM antibodies are occasionally produced at low level during the secondary and later immune response, they are always produced by cell encountering the antigen for the first time, namely the mature naive B cell newly emerging from the bone marrow. So every time if there is a first infection, there will be always be IgM is produced, and in the subsequent election there might be less IgM produced and other immunoglobulin will be predominant, or say other immunoglobulin like immunoglobulin G, immunoglobulin A will be more predominant. So you have understood, hope you have understood about this class switching as well. Okay, and it depends upon the signal that has been sent by the helper T cell that's determine the isotype switching. It will be immunoglobulin G or immunoglobulin A or immunoglobulin E. Okay, depends upon the signal sent by it. We have understood the affinity maturation due to the mutation, and that's actually compensate your avidity of your immunoglobulin M. And we have also understood about how this B cell got activated. They also act as antigen presenting cell, and they also get activated and form into the plasma cell. So we hope you have understood about the B cell activation, conversion of the plasma cell, and their affinity maturation and isotype switching as well. Thank you.